Hi, this is Shelley Kraft. We're coming to you live on SNNLive. We're at the AdvaMed 2011, which is also known as the MedTech Conference, and we're here in Washington, D.C., our nation's capital. I have David Fischell, Dr. David Fischell, a PhD from Angel Medical, a private company. Welcome to SNNLive.
Thank you very much.
It's good to have you. I love the name Angel combined with medical. What do you got?
Well, what we've got is an implantable heart attack detection system that is put in like a pacemaker in patients who've had a heart attack for the first time. People who've had a first heart attack have a very, very high risk of having a second one, and that second heart attack is generally horrendous for them. Like a 75-80% chance they'll end up in heart failure. It'll ruin their life if they survive, and in many cases they don't survive. The whole idea here is people wait to come into the hospital typically 3 hours after they have symptoms, and half the people don't get normal or any symptoms in some cases. So what we can do is we can warn them up to 9 to 12 hours before their actual heart attack, when their artery ruptures and starts to close, that they should go to the hospital now. The device has a vibrator like your cell phone, and they get a pager that beeps at them, and it flashes a light and it says, call 911 now, don't wait. And you know what? They don't wait. Whereas in most cases, especially men, are in denial. They'll say, oh, I just worked out too hard yesterday, it can't be me, and they will wait and they'll wait, and finally by the time they call and get in, it's 3 hours past and the damage is done. Their heart is damaged irreparably, and they're on their way to a very difficult rest of their life.
Do you have first mover advantage?
Yes, we do.
That's big.
We have 16 issued patents on this. I'm a long-term inventor. I guess I have 100 issued patents, and my family has a long history of work in this field. My dad was one of the inventors of the ICD. So there's nobody else working on this. The only other company doing anything is St. Jude Medical, who is licensed our algorithm to put in their pacemakers and ICDs, which is for those that need pacers or ICDs. We're dealing with those who've survived a first heart attack and are at real high risk for having another one.
All right, let's get the website out right now. I'm going to come back and ask you another question, but obviously, you know, when we come to a conference that like in AdvaMed, you know, there's so many new technologies that are going to save people's lives that we want to get them out on the air immediately. So tell us the website.
The website is www.angel-med.com. So
now, okay.
So angel-med.com.
Dash. Like I said, angel-med.com. Okay, good. I'm glad we got that out of the way. So what do the doctors think of this? What do the heart guys? They must love this.
The heart guys really love it. The two PIs for our big study, we've already completed 2 studies. A year ago, we had our first 2 studies published in the Journal of the American College of Cardiology, showing we could get people from the time they got alarms into the hospital in under 20 minutes. So it's as opposed to 3 hours. So it makes a big difference.
So once it's in, it stays in, right? You don't have to take it out and change it. It doesn't run out of batteries.
Well, it does run out of batteries, but by the time we get to our commercial device, it'll last for 7 years. The docs that we're working with, the principal investigator for our study is Dr. Michael Gibson at Harvard, who runs, for those in the medical field, what's called the TIMI group, who studies heart attack. He's one of the world's expert in heart attacks. Our co-PI is Dr. David Holmes from the Mayo Clinic, who's the president of the American College of Cardiology. So we've got like the who's who of medicine believing this, because no one has solved this problem of getting the patients to the hospital when their arteries close. They sit and they wait, and 10 years of education, it still takes 3 years.
Or they go and it's not the right time to go. They may have had a false positive.
Well, it actually turns out 70% of people who go to the hospital with chest pain don't have a heart attack. But that's not in our case. Our false positive rate is extremely low, under 5%. And that's partly because the algorithm, this has a pacemaker lead in your heart, so it's right in the sweet spot where your heart muscle is yelling and screaming that it can't breathe when you close an artery, which is what happens when you have a heart attack.
Okay. Is it ready for the market yet?
We're commercial in Brazil. We're approved to sell in Europe, but we haven't launched yet. We have to complete a big clinical trial now in the U.S. We're about halfway done. We'll get our first look at the data in a little over a year, and from that point, knowing how long the FDA takes, it'd probably be another year to commercialization in the U.S.
Angel-med.com. More information, anything else you want to add? How much is it going to cost?
We think it'll cost a little more than a pacemaker, which for a device would be in the $10,000 to $12,000 range.
No money when it comes to life.
Correct, and what's more is no money when it comes to the cost of heart failure. The cost of a major heart attack downstream over the next 7 years can be close to $1 million. So you don't have to prevent too many of them till a $10,000 or $12,000 device really pays for it. So this not only can save lives, save damage to your heart, but we think in the end it's going to save money for the healthcare system, and there aren't many new technologies that are pointed in all those directions.
How did you get the name Angel?
I have to give my younger daughter credit. We were on a family trip and trying to come up with a name for the company. She said, Dad, this is like a guardian angel. It's looking out over the patient, always watching their heart to see if something's wrong. And she wants to make sure whenever I talk about it that I give her credit. She wanted a royalty, but I said, how about I pay for your college education?
I can't touch that one with prongs, ladies and gentlemen. I want to thank you so much. Angel-med.com. Please go to the website, follow the progress of this company. Thank you, Dr. Fischell. It's been my pleasure.
Thank you very much.